Hello, welcome you all to the Medical Emergency Hospital, where I know a lot of the medical terminology, CNA, LPN, RN, BSN, and MSN can be very confusing. Here's a little clip to show you how confusing some people can get on the medical terminology.
No. Really? Because I think that kind of sums up everything. No! Oh, sorry. Sometimes these catheters can pinch a little bit. Well, thanks for listening. I really appreciate it.
You got a real gentle touch there, Doctor. She won't be able to say no.
Actually, I'm a nurse. Doctor will be right in.
Now that you all know you aren't the only ones that get confused about all the medical terminology, I'm here to talk to you about the different levels of nursing. Today, I would like to introduce you to the first level of nursing. The first level of nursing is a certified nurse's assistant, also known as a CNA. Then I will move right into the next level of nursing, which is a licensed practitioner nurse. Then I will wrap up with the middle level of nursing, which is a registered nurse. Today, I would like to introduce you to the first level of nursing, which is a certified nurse's assistant, also known as a CNA. According to Nurses Assistants Guides.com, CNAs do a lot of vitals, baths, feeding, and the general caregiver needs of residents. CNAs mainly work in either nursing homes or hospitals. I strongly believe CNAs are some of the most hardworking people around, although they are at the lowest level of education. Now that we know a little bit more about CNAs, let's move on to the next step of nursing. The next step of nursing is a licensed practitioner nurse, also known as an LPN. According to practicalnursing.org, LPNs have a lot of duties and responsibilities, such as their medications, charting, and treatments, such as changing dressings, inserting and caring for catheters, and collecting specimens, urine, or blood. LPNs do work a lot of times in nursing homes, hospitals, schools, or even they can do in-home healthcare. Now that LPNs, I believe, are some of the most time are some of the most time-consuming people around. Now that we know a little bit more about LPNs and CNAs, let's wrap up with the last level of nursing, which is the middle step of nursing, which is known as a registered nurse, also known as an RN. According to VillanovaU.com, RNs have a lot of responsibilities and duties where they have to record and observe residents' behaviors. They have to oversee CNAs and LPNs. They also have to perform diagnostic tests, and they also have to treat medical emergencies such as heart attacks, strokes, burns, or car accidents. RNs a lot of times can work anywhere. They can work in nursing homes, hospitals, medical offices, schools, or even rehabilitation sites. Now that we know more about LPNs, CNAs, and RNs, let's recap. First, I talked about CNA, certified nurses assistants, also known as CNAs, and then I moved right into the the second level of nursing, which is a licensed practitioner nurse, also known as an LPN. And then I wrapped up with the middle level of nursing, which was a registered nurse, also known as an RN. Thank you all for coming out to the medical emergency hospital. Well, I know a lot of the medical terminology can be very confusing, but I hope to see you guys around or even see you become a CNA, LPN, or RN, where I know you can find the best care out there.